Hi, my name is Abby Rockers. I'm a 5th semester nursing student. Today is February 21st. It's approximately 4:00 p.m. and I will be performing a male Foley catheter insertion today. So before I would get started, I would want to assess my patient. I would want to assess for my client's condition, the size of the catheter that he would need, the method of catheterization, the last time that he voided, and check for allergies, specifically iodine and latex. I would walk in the room, I would introduce myself, I would say, hi, my name's Abby, I'm going to be your nurse today. I would provide privacy, perform hand hygiene, and ask for my client's name and date of birth. Can you give me your name and date of birth, please, sir? And then I would verify that on his wristband. That's good. So I would raise the bed to working height, so I wasn't bent over. Unfortunately, this bed's not working today, so I would have it raised up in a real life situation. I would explain to my client that I was going to be performing a catheterization on him today, and explain the procedure, and let him ask me any questions if he's concerned with anything. I would come over here. I would use Clorox wipes to clean off my field here that I'm going to be working in. So I would do that, and then I would gather all my equipment. So I have my Foley catheterization kit here. I have my bed bath blanket that I would be using in real life, but so you can see better what I'm doing. I'm not going to be using that today. So I'm going to put that over there. I also have my perennial care wipes and my clean gloves. So before I get started, I'm going to perform hand hygiene. Put on my clean gloves. The bed would be at working height at this point, like I said. I would remove this blanket here. I would get my client positioned right, supine position with legs bent, knees bent. And then I would provide perineal care. So I would go in fashion of top to bottom, dirtiest to cleanest, and then finish off cleaning the tip. I would then throw that away. Take off my gloves. Put this to the side for now, and this as well. And perform hand hygiene. And I would begin to maintain my sterile field. So I would open this over, furthest away, touching only the outer inch of everything. I'll put these to the side to put on in a second. I will then open this up, touching only the outer edge, the outer inch. I would put the shiny part down, and I would place it underneath the client, touching, like I said, only the outer inch border. I would then come back and put on my sterile gloves. With my non-dominant hand first. Keep my left hitchhiker thumb out there. Take this out above the waist and throw it away. I would then organize everything. So I put this over here, put this to the side. I would then take my 10 mils here, make sure it matches the 10 mils on the little red thing here, and I would follow policy protocol for whatever hospital or clinic that I was at. Some places, once you test the bulb, others do not require it, but here I'm just making sure that this works. And it does. So I will keep this in the tip for now. so it's ready to go in a second. I will then open my sterile lubricant and have that ready to go over here. I will also open up my iodine and moisten the cotton swabs with it to clean, and I will throw that away as well. And then from this point, I'll bring this over to clean. Now this hand is not sterile anymore since I have touched it. I will clean around the meatus. If this patient happened to be uncircumcised, I throw this away above. If the patient happened to be uncircumcised, I would lift the foreskin and then clean underneath the meatus there, making sure I got it, but this patient is, so I don't have to worry about that. I would throw this away again. So now it's clean and ready to go. I will then lubricate the tip of my catheter 6 inches. Bring the rest of this over here, making sure this stays onto my sterile field. I would ask my patient to take a deep breath. And I would insert the catheter 7 to 9 inches until I saw urine. Then when I saw the urine backflow, I would go 2 more inches in. Which at that point, this is still unsterile. Inflate the bulb. Take that off. I will tug, make sure I meet resistance in order to make sure that that bulb is filled properly. Put this over here. At that point, I will be able to let go. I will remove my sterile gloves. I will perform hand hygiene. I will don my clean gloves. And then I will secure this to the inner thigh, making sure that the airways, the catheter is patent and that the port is accessible in case they would need to do a urine sample. So I would secure that with tape, and then I would lower this below the patient so urine could drain properly. And I would put it on a non-movable part of the bed, making sure that no loops are there. I would then remove this, throw that away, put my patient back into a comfortable position, put the blankets back on. I would lower this down for safety purposes to make sure my client would not be a fall risk. And then I would go and I would document the time, date, and size of the catheter that I inserted. And I would also want to note if there was any urine that came out. If it was, I would note the color, the amount, and the turbidity of it. And that is it. Thank you.